Amerge is a medication used to treat migraines. It helps to relieve headaches, pain, and other symptoms of migraines, including sensitivity to light/sound, nausea, and vomiting. Prompt treatment with Amerge can allow you to get back to your normal routine and may decrease your need for other pain medications. It's important to note that Amerge does not prevent future migraines or reduce how often you may get a headache. Amerge belongs to a group of drugs called triptans, which affect a certain natural chemical, serotonin, that constricts blood vessels in the brain. It may also block other pain pathways in the brain. The recommended daily dosage of Amerge is based on the severity of your migraines, and it's best to take it as soon as you feel a migraine coming on. Always consult with your healthcare provider for the best timing and dosage for your specific needs. Before taking Amerge, it is important to read the patient information leaflet provided by your pharmacist. Take 1 tablet by mouth with or without food, as directed by your doctor, usually at the first sign of a migraine. Do not take Amerge to prevent a migraine. If there is no improvement in your symptoms, do not take any more doses before talking to your doctor. If your symptoms are only partly relieved, or if your headache comes back, you may take a second dose after 4 hours or as directed by your doctor. Do not take more than 5 mg in a 24-hour period. If you have never taken this medication before and have risk factors for heart disease, you may be advised to take your first dose in your doctor's office to monitor for rare but serious heart problems. The dosage is based on your medical condition and response to treatment. Tell your doctor if your condition does not improve or if it worsens. If you are using drugs for migraine attacks on 10 or more days each month, the drugs may actually make your headaches worse. Do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Some common side effects of Amerge may include flushing, tingling/numbness/prickling/heat sensations, weakness, drowsiness, or dizziness. If these effects persist or worsen, inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Amerge may also increase your blood pressure, so it's important to monitor your blood pressure regularly and notify your doctor if it becomes elevated. Be sure to contact your doctor immediately if you experience any serious side effects, such as blue fingers/toes/nails, cold sensation in hands/feet, hearing changes, or mental/mood changes. Triptan, the active ingredient in Amerge, can sometimes cause chest/jaw/neck tightness, pain, or pressure, which is usually not serious. However, these symptoms can be similar to those of a heart attack. Seek medical help right away if you experience fast/irregular heartbeat, fainting, severe stomach/abdominal pain, or signs of a stroke. It's important to note that Amerge may increase serotonin levels and rarely cause a serious condition called serotonin syndrome/toxicity. The risk of this condition is higher if you are taking other drugs that increase serotonin. Contact your doctor or pharmacist if you experience symptoms such as fast heartbeat, hallucinations, severe dizziness, or unexplained fever. While a serious allergic reaction to Amerge is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you experience any other effects not mentioned here, consult your doctor or pharmacist. Before taking Amerge, it's important to let your doctor know if you are allergic to triptan or other triptan migraine drugs, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Before using Amerge, inform your doctor about your medical history, especially if you have heart disease, decreased blood flow in the brain, blood circulation disease, certain types of headaches, kidney disease, or liver disease. If you have risk factors for heart disease, such as diabetes, a family history of heart disease, high blood pressure, high cholesterol, being overweight, smoking, being female after menopause, or being male over age 40, be sure to tell your doctor. Amerge may cause dizziness or drowsiness. Avoid alcohol or marijuana, as they can increase these effects. Do not engage in activities that require alertness until you know how this medication affects you. It's important to limit alcoholic beverages and talk to your doctor if you use marijuana. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. The risk of heart disease and high blood pressure increases with age, so older adults may be more sensitive to the side effects of Amerge. If you are pregnant, Amerge should only be used when clearly needed. Discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Amerge. Your doctor should be aware of all the medications and herbal products you are using. If you are taking any ergotamine medication or other triptan drugs, it's important to separate your neurotriptan dose from these medications to reduce the risk of serious side effects. Your doctor can advise you on how long to wait between doses of these drugs. Additionally, the risk of serotonin syndrome/toxicity may increase if you are taking other drugs that increase serotonin levels. This includes street drugs such as MDMA/ecstasy, St. John's wort, and certain antidepressants. Be cautious when starting or increasing the dose of these drugs while also taking Amerge. If someone has taken too much Amerge and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. When you have a migraine, take Amerge as directed by your doctor. It should not be taken regularly. Do not increase your dose or take it more often than prescribed. Certain foods, beverages, additives, and lifestyle patterns may trigger migraines. Avoiding these triggers may help decrease the frequency of migraines. Consult your doctor for more details. Your doctor may conduct lab and medical tests, such as blood pressure, while you are taking Amerge. Be sure to keep all medical and lab appointments. Amerge is used to treat migraines. It helps to relieve headache, pain, and other migraine symptoms, including nausea, vomiting, sensitivity to light/sound. This medication is not used to prevent migraines. Take this medication by mouth with or without food as directed by your doctor, at the first sign of a migraine. If there is no improvement in your symptoms, do not take more doses of this medication before talking to your doctor. If your symptoms are only partly relieved, or if your headache comes back, you may take another dose at least 2 hours after the first dose. Do not take more than 6 mg in a 24-hour period. Do not take more than 2 doses in any 24-hour period. Remember to store Amerge at room temperature, away from light and moisture. It's important to keep it in a safe place, out of reach of children and pets. When you no longer need it or it's expired, make sure to properly dispose of it by consulting your pharmacist or local waste disposal company. And never flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.